AP 120, Lab 12. Topics: respiratory volumes and effects of blood pH. So, lung capacity is very important for our health. There are devices called spirometers, both simple and complicated, that help to measure ventilation, measure the amount of air our lungs can contain. And basically, through different amounts of effort in breathing, we can move different amounts of air into and out of the lungs. And these all have been broken down into volumes. Tidal volume is the amount of air that we breathe in and out during one quiet breath. One quiet breath. And that amount is actually relatively small compared to the total amount of air in the lungs. So it's about somewhere between 400 and 800 milliliters. Then we have the inspiratory reserve volume. This is the extra space in the lungs that could fill with air if we breathed in as deeply as we possibly can, so with maximum effort. So that would be the inspiratory reserve volume, which, as you can see, is a number of liters. So it's a very large amount. We can breathe in a lot more air than we normally do. Then there's the expiratory reserve volume. This is the excess amount of air in the lungs that we could exhale if we breathed out as hard as we could. So that would be the expiratory reserve volume, which is maybe a liter. And finally, the residual volume. The residual volume is the air remaining in the lungs after maximum expiration. So you breathe out all the air you can. There is still some air remaining in the lungs, critical for keeping the lungs properly inflated and keeping those alveoli able to function. And that is maybe about a liter or so. So tidal volume, the amount we breathe in and out normally in a relaxed state. Inspiratory reserve volume, the extra amount of air we could breathe in. Expiratory reserve volume, the extra amount of air we could breathe out. And then residual volume, the amount that always remains in the lungs. And then the vital capacity is a very important number. It is the maximum amount of air that you can breathe in and out. If you try to breathe in as hard as you can and then breathe out as hard as you can. That is the vital capacity. And that is probably the most important number that is determined using a spirometer. So vital capacity would be expiratory reserve volume plus tidal volume plus inspiratory reserve volume, all of that air. And if we were meeting in person, we would be doing that. All right, controlling our breathing. Surprise, surprise. It is structures in the brainstem that help control breathing within the pons and the medulla oblongata. Because breathing we can control without thinking about it. It is something we can unconsciously control. Although if we really want to, we can voluntarily affect our breathing. So the thing that is important for respiration is the levels of carbon dioxide in the blood and the blood's pH. These are the two things that have the greatest effect on the rate and depth of breathing. Oxygen levels in blood do as well a little bit, but those have to get pretty extreme to affect the breathing rate. The primary effectors are carbon dioxide levels and blood pH, and it turns out carbon dioxide levels affect blood pH. So it's not surprising that these two are linked. So we have peripheral chemoreceptors in the main arteries that are detecting for changes in oxygen levels in the blood, in pH levels, which would be hydrogen ions specifically, and in carbon dioxide levels in the blood. So these are being detected by these chemoreceptors and sending information to the brainstem all the time. We also have central chemoreceptors in the central nervous system that are detecting the pH of the cerebrospinal fluid. Turns out the pH of blood directly affects the pH of the cerebrospinal fluid because the cerebrospinal fluid is made directly from the blood fluids. And the most delicate tissues are the nervous tissues, and so if the pH gets too far out of whack, that could have very bad effects, very negative effects on our brain and spinal cord. So, our cells in our body are always producing carbon dioxide. Because carbon dioxide is a waste product from aerobic respiration, so making ATP is going to lead to carbon dioxide being produced. And then that carbon dioxide ends up in the bloodstream. If carbon dioxide levels in the bloodstream get too high, then the pH of the blood will get low, will get acidic. So carbon dioxide, more carbon dioxide equals lower blood pH. And this makes sense if you think about it. Think about it. If you are exercising really hard, your muscle tissue is going to be more active, producing more carbon dioxide. And so you're going to have to breathe harder and faster to get rid of that excess carbon dioxide. That's why we breathe hard and fast when we exercise, to get rid of the carbon dioxide. So high blood carbon dioxide levels will also affect levels in the cerebrospinal fluid, making the cerebrospinal fluid more acidic, and the brain does not want that to happen. That is the most powerful effect for breathing, is the pH of the cerebrospinal fluid. So this will stimulate us to breathe in deeper and faster, irrelevant of oxygen levels. Blood pH is going to hurt us a lot faster than oxygen levels. So we breathe in deeper, we breathe in faster to get rid of the excess carbon dioxide. Lower carbon dioxide levels in the bloodstream will then lower carbon dioxide levels in the cerebrospinal fluid, which will then raise the pH. Now, that means we breathe faster to get rid of carbon dioxide. Now, hyperventilation, breathing faster, occurs when we exercise hard. Can occur in some people if it's uncontrolled, if they have some sort of anxiety attack, for instance. They may hyperventilate. This means it's out of control, which means we are losing too much carbon dioxide. So uncontrolled hyperventilation will cause us to lose too much carbon dioxide. Carbon dioxide levels in the blood go down. This will then raise blood pH. The blood will become more alkaline, more basic. And of course, this then affects cerebrospinal fluid. Low carbon dioxide levels in blood mean low levels in cerebrospinal fluid, which means the cerebrospinal fluid becomes more alkaline, has an increase in pH. And this is, of course, bad. We need a certain level of pH. If it's too high or too low, it is bad. And so the brain will say, we got to stop this uncontrolled hyperventilating. This is bad. And it will cause us to breathe slower and more shallow so that we lose less carbon dioxide and the levels can build up again. And if you are having an anxiety attack and breathing in and out way too fast and can't stop that, then the brain will do what it must and it will cause you to pass out. Now, a side effect of all of this is that we can hold our breath longer if we first hyperventilate briefly before holding our breath. Why? Well, if we hold our breath after breathing normally, that means our carbon dioxide levels are at their normal level, and it'll take a certain amount of time for carbon dioxide levels to build up in the blood before we feel the overwhelming urge to breathe. It just takes a certain amount of time, say 30 seconds. Now, if we hyperventilate briefly first, then we lower carbon dioxide levels, which means it's going to take longer for the carbon dioxide to build back up to get to a level that makes us feel like we absolutely must breathe again. And so that means we would be able to hold our breath for longer. So remember that trick if you're ever in a who can hold your breath the longest contest with someone. And that is it for this lecture.